everybody. I am Michael Munson with Forge, and I'm really happy that you are all here. I'm glad to see some familiar faces or familiar names in our participant list for tonight, our attendee list. This is part 2 of a 2-part series. Maybe we'll have it be a part 2 of a 3 or 4-part series, depending on if Jay and Afton want to do part 3 or part 4 down the road. Let me just frame us a little bit in our time tonight and some of those housekeeping bits and pieces. Like I mentioned just a second ago, everybody is in listen-only mode and a no video mode other than who you're seeing on the screen right now. Hopefully you are seeing 4 little boxes on the screen, 1 with ASL and then 3 of the rest of us. If you're not, I believe you can change your view. You might not be able to change your view. So if you have a question or a challenge with that, Caleb on Forge's staff is in the back end. So feel free to ping him and he will try to figure it out because he figures out all the stuff that I don't know how to do, which is fantastic. You will also be able to access automatic captioning, so they're not always super accurate, but it's helpful for some folks to have those captions on. So you can just click the CC at the bottom of your screen and they should pop up as subtitles. We have a couple of ways for you all to ask questions tonight. One is through the Q&A kind of box where you can ask anonymous questions as well as use your name as well, or you can ask questions in the chat and we'll be monitoring those and collecting them for Jay and Afton to respond to towards the end of tonight, unless if they feel like responding in the middle if it's something that seems relevant to address right then. So I think those are the bits and pieces of housekeeping. I would like to start us out with just a moment of reflection. And if the moment of reflection for you means acknowledging the land that you're standing on, sitting on, being on, I encourage you to think about where you are in this world and what this world means to you. And if you believe that you're on borrowed land, like many of us do, to acknowledge and thank the people that came before us. Thank you. For visual accessibility, I am a white appearing, rather round person with graying hair, glasses, and a really wild paisley shirt, very multicolored shirt with a black background behind me. Forge, for those of you who don't know, is a national trans anti-violence organization. We've been around for 28 years. We really enjoy providing programming like this, which is tangentially about victimization and violence and trans survivors. And in some ways, it's really directly about trans survivors. We'll see where we go tonight, but we are glad to do the work that we do and be able to partner with great people like Jay and Afton. I am going to turn things over to them. They did a fantastic job 2 weeks ago, and this will be kind of a continuation and expansion of what happened 2 weeks ago. If you haven't heard the first one, the video is going to be posted really soon, and so you can watch that first part as well as this one, which will be up in a week or so. So Jay, Afton, thank you for being here, and I'm going to let you all take over. Thank you.
Just a real quick who I am before we dig into the dirt. My name is Jay. I use they, them pronouns. I currently in my day job coordinate trans health service program here in Virginia, where I am located. But more important to my personal experience as like a queer non-binary trans person is also the community organizing, mutual aid, defense work and activism work that I do. I've been doing trans health care, sexual health, reproductive health, HIV stuff, sexual pleasure stuff for a really long time now. So I am really honored and have worked with survivors as well, have a really long history with Forge. So I'm really honored to be here and thank you all for spending time with us.
Hi, everybody. My name is Afton. I use they or he pronouns. A little bit about me before we get into everything tonight. I am a nurse and a social worker. I help provide direct care to folks for reproductive care, sexual health, primary care, and trans health care and hormone therapy. I have a background also in providing lots of training and ongoing education and helping in research initiatives to help provide education and technical assistance to both healthcare and behavioral healthcare providers and institutions, specifically regarding LGBTQ plus healthcare.
Okay, so the agenda that we hope to cover for today is going to be, we're going to talk a little bit about trans healthcare at reproductive agencies, a little bit about caring for our parts, which that means our body parts, specifically as it relates to reproductive healthcare. We're going to talk about some contraception methods for trans and non-binary people, some options that we have, the intersections of current political issues that are going on in our current world and how these are impacting our providers as well as our patients that are trans and non-binary and doing trans and non-binary care as well as reproductive care. And then talking a little bit about what trauma-informed healthcare looks like for trans and non-binary folks. And then also talking about some fear and safety concerns that we have, as well as some like strategies and tips that you all can hopefully, try to apply in the communities that you work with or are in part of as well if you're someone that's on this call and also trans and non-binary. I do want to note real quick that this is the quick and dirty version of it. We could probably talk about any of these core topics for hours, especially when we get into like the actual contraception and healthcare stuff. So we hope to do our best to give you a really brief summary, but we're always available to talk afterwards, not tonight because it's late here, but follow up by email. So yeah, we'll go ahead and go forward. What is reproductive health? So a lot of people, when they think of reproductive health, some people, not all, but some people have a really narrow version of what reproductive health is, and they automatically think of like abortion and sometimes like condoms and contraception and stuff like that. But what we know is that what we know about reproductive health is that it's so much larger than that. Our reproductive health includes our sexual health. It includes parenting, so our right to parent or not parent. It can also, like I said, mention those things that a lot of people think about when they think of reproductive health: birth control, emergency contraception, abortion. And then also gender affirming hormone therapy. This is really essential for a lot of trans folks, and oftentimes HRT or hormones are kind of placed in their own category, but what we know is that trans healthcare is reproductive healthcare. So we like to mention that when we're talking about all of these things, and also much more that we're probably not even covering that you could put onto reproductive health. So know that it is about all of you, and it is an essential core component to wellness. When I talk to all of our trans and non-binary patients, I always talk about like, make sure that you're not only like talking about how your hormones are like, having the changes that you want and your goals for your transition, but make sure that you're also bringing up like how it's impacting your periods or your pleasure, or how it's impacting when you have OBGYN exams or things like that. So it's so much of us that's often left behind when we think of health and wellness. Next slide, please. So what does trans health at reproductive focused agencies look like, or what does it have to do with one another? Some people think that the two are separate, or that one agency just focuses on one thing and another agency just focus on another thing, and that they're not connected. But actually what we know is that many trans and non-binary people receive their healthcare at places like Planned Parenthood or similar agencies like Planned Parenthood that kind of have that community healthcare approach that serve a lot of folks that are at the like intersections of poverty and accessing care that's often stigmatized, unfortunately, or shamed in the country. And actually, fun fact, one of the things that we know now is that Planned Parenthood is actually one of the largest providers of trans healthcare as it relates to hormone therapy in the country. And the one that we're associated with here in the South is actually one of the largest agencies in the country that serves trans people, which is pretty cool. So just know that the two are interconnected. And we kind of talked about this in the first session, but that bodily autonomy, as far as it comes to like reproductive care and abortion care, is so intertwined with trans health care because it's about bodily autonomy. So why we're mentioning this is because that we know that the current political climate is impacting services. So when we think about that states that have unfortunately made abortion illegal or they're not able to provide it, when Roe versus Wade fell, we know that this is impacting our trans and non-binary patients, and that they are seeing a loss in services in some places. So some places have had to close down. Some places that are still able to provide abortion services are seeing an influx in what we call safe haven states, where many people are traveling to those states to get abortion care. But because of that demand that people are receiving, we're having to balance trans healthcare and primary care and then abortion services, which can often like lead to wait times, longer travel times, and the loss of providers, or the loss of clinics, or increased wait times, really busy staff, all kinds of things are leading to maybe not the greatest trans or trauma-informed care with providers, or patients are going somewhere else and not getting the trans-informed trauma and care that they deserve, or they're just not seeking care in general, which we know, of course, when people are not getting the care that they deserve, that they're having worse healthcare outcomes in the future, unfortunately. And now I'm going to turn it over to Afton to get into some of that nitty gritty about reproductive health.
So we wanted to make sure tonight that we did talk a little bit about some specific healthcare components. What we know, as I'm sure many of us know on this call, is that often we all don't receive any education or training specific to these topic areas as it relates to trans and non-binary patients. So I want to make sure that we all have some working knowledge, especially given the context of the time we're in now, because more so than ever, it can be on us to make sure that we're helping provide that community education and empowering our clients and patients and community to know what they have access to and what is available and what is safe and effective for them. So we're going to talk a little bit about sexual health specifically and get into some information about birth control and contraception. What's important when we think about these reproductive health concepts like STIs, sexually transmitted infections, cancer screening, specifically thinking when it comes to reproductive health, things like cervical cancer, breast cancer, those sorts of cancers that affect our reproductive organs, and overall genital and sexual health, is that we know that when it comes to trans and non-binary folks, that often our providers don't always have the knowledge base that is needed to know what is best for the bodies we have, how to engage in those conversations, and how things that people may seek for gender affirming care like hormones or surgeries may impact people's healthcare and what types of screening and preventative health they need. So when we think about sexual health screenings, what I like to always emphasize is that often when we think of the history of trans healthcare and healthcare for LGBTQ folks as a whole, is there's been a large emphasis on kind of matching trans healthcare to HIV prevention. And that has led to some really wonderful organizations, some that I've worked for, that have been able to provide hormone therapy and reproductive care all in that same umbrella. But it often comes with a layered stigma that a lot of people will assume that if you are a member of the queer community or trans and non-binary, that you may yourself have a high risk for STIs. And we know that many people don't. We know that when it comes to risk factors for sexually transmitted infections, it needs to be individualized and not based on a group. So for example, I think many of us on this call probably understand that there are higher rates of HIV amongst Black trans women, specifically when we look at population and community statistics. But that doesn't mean that every trans woman who is Black has a higher risk factor. And so we really need to make sure we're treating the individual and engaging on a conversation on an individual patient-centered level. We do know that we do have some statistics that do demonstrate things like we have seen from some systemic reviews that STI prevalence is about 21% greater in trans women compared to looking at men who are trans. But we also know the data is limited and that historically trans people have been erased and forgotten when we think about this data, and often may have been lumped into statistics revolving around gay men or heterosexual or straight women. And so we still have a lot to learn when it comes to our health institutions providing community-centered and culturally competent care. What we do know is that when we're thinking about what risk people may have in our lives, and this says clinicians, but I often say, you know, when I leave work, I'm also still talking to my friends and loved ones about their sexual health. So it can apply to everybody, but that we need to make sure that when we're thinking about risk, we're basing it on the current anatomy and behaviors that somebody has. And because we know that trans people are diverse and not every trans person is the same, we need to know things about surgical histories, hormone uses, patterns of sexual behavior, and what kinds of symptoms may be impacting our patients. And if we don't know the patient in front of us well, then we may miss something that could be really important for their current care and future care. So one thing that I like to highlight when we're thinking about how to have those conversations and engage in behavior, this is one example of many that exist out there, and we have some resources at the end of this to help with that, is how we get that data and how we get that information when we're talking to our clients or our patients. We know that trans and gender nonconforming and non-binary folks don't always use the same words for body parts, and so it can be really important in the beginning of a relationship with a patient to learn what words they use and what words you may use, and try to find a way to engage in dialogue with patients using and mirroring the language that they use to help prevent further trauma that can sometimes find itself in a conversation between a provider and a patient without intention on the provider to cause harm. So these are some examples of words that I've had folks use in front of me when talking about their genitals. So they could use words like front hole, back hole, girl dick, clits, and many other words out there, similar as when we think about pronouns people may use or ways they may identify their gender. There's many different terms out there, and if we don't ask, we don't know. I like to reference the 8 Ps for those who are involved in sexual health on this call. Historically, we've referred to the 5 Ps when we think about how we ask about sexual health and histories. I like the 8 because the 8 also focuses on things like focusing on pleasure and also making sure we're incorporating appropriate screening for any abuse or violence. So while as a clinical person, I do want to make sure I know what specific behaviors are happening, what previous infections somebody had, things like that. It's just as important that I understand when it comes to their full sexual health, how they experience pleasure. Are there things that are impacting their ability to experience pleasure, especially things, even medications can do that. And of course, most importantly too, are they experiencing any form of violence or abuse that may contribute to their risk, both when it comes to their sexual and reproductive health, but their overall health and wellness as an individual. I think it's important when we think about partners and asking questions about partners that we also check our own biases and implicit biases that we may that can creep up in individual interactions when we assume how many partners somebody has or what those relationships may look like. So thinking of things like BDSM practices, poly relationships, open relationships, and being careful that we're engaging in a culturally informed manner. So I give the example of, you know, if I'm seeing a patient for sexual health screening and there may be bruises on their body, engaging in that conversation in a mindful way, because those bruises may have came from a consensual act. And so it's important that we are having those conversations beyond just thinking of trans and non-binary folks, but all of our patients and the multiple beautiful diverse ways that people can experience pleasure and healthy relationships. So this gets a little bit more clinical, so I apologize for folks who may not have that clinical brain, and it's okay that you may not understand all the terminology. As Jay had said, we could spend hours on each of these topics alone. I use this slide even for those who aren't familiar with medical terminology to highlight when we think about surgeries that people may access as trans and non-binary folks. There are many different surgeries, and those surgeries can have an impact on our whole health, including our sexual health. And that for us, when we're seeking healthcare, if our providers are unaware of how surgeries can impact our bodies and our infection risk and what we may need to know when engaging in healthy sex, it can negatively impact us and impact the care we're receiving. So for those who may engage in this kind of conversation with folks, it is always important to make sure we're taking what I call an anatomic or organ inventory. If I don't know what organs are present, especially when I'm thinking about cancer screenings, I'm not providing good quality care for you. So I need to know those. I also need to know when I'm thinking about sexual health and STI risk, what body parts are present. So I know that I'm doing the right types of testing and that I'm making sure I'm providing education that's relevant for you and not assuming that you have certain body parts or having certain types of sex. And as a provider, I really want to make sure I understand that some surgeries can make it so that you may have physical symptoms that can look like STIs, but may not be STIs. And a good example on this slide that I highlight is a lot of people will have a vaginoplasty done as a surgery that helps construct what medically we call a neo-vagina or new vagina from existing body tissues. And that vagina can develop infections from hair follicles that were used from the skin that was used during that procedure that can look like an STI. And so if I automatically assume it's an STI and don't think through what else it could be, I could be missing something, not doing the right treatment. And also I could potentially cause an issue in their relationships with their partners if now I'm telling them they have an STI, and then that leads to further dialect and the potential for abuse or violence that didn't need to happen. Sorry, I have two screens going, so I couldn't see my mouse. Often when we think about sexual health, we also sometimes forget about the impact of healthy screenings and wellness. We know trans and non-binary folks are less likely to access this care for many reasons related to stigma. We know those who are in lower socioeconomic classes, living in poverty, those who are not white, and those who don't have access to insurance are many reasons why somebody might not be accessing this care. And in addition to that, even for those who may assume some of those other privileged roles, when you are trans and non-binary, you may not be able to access necessary things like a pap smear for cervical cancer screening because you may not have a provider that you can go to that you know is trans affirming. And you may not understand or know that it's important for you to do that, especially after hormone intervention and things like that, because if we're not providing that education in our schools and community level about what we need to do to help our own bodies stay healthy, then people in the community may not know that it's just as important for them to do these screenings as well. So we know that the reasons we see lack of cervical cancer screening in trans and non-binary folks beyond other stigma and barriers is due to lack of medical knowledge about the risk, both on the patient and the provider side. The dysphoria that some may experience. This is a pretty invasive exam for those of us who have experienced it. And if we already have stress that is created by those body parts, the thought of going through an exam like this may be enough to say, no, I'm not going to do that because for my own mental health and wellness, I'm going to avoid that. We also know that testosterone makes it harder. We know that we see higher rates of not good samples and results. And I know that it can also be more uncomfortable because testosterone causes what's called atrophy or thinning of the tissue of your genitals, which can make that even more uncomfortable. And so if we're informed providers who are providing patient-centered care, we can do things to make that better for patients. We can provide medications that can help provide some numbing or relaxation. We can also use medications beforehand that can make it so that that procedure is less comfortable and ensures that we get really good results. And that can be what's referred to in the bottom right of this slide when we talk about using estrogen in a certain way that actually helps make sure that we get those good results. Other things beyond cervical cancer that are important to consider is that when we think of any invasive exam, there's trauma that can occur for anybody, whether that could be related to gender dysphoria, it could be related from previous trauma. If somebody is a survivor, has previously been assaulted, there could be further trauma that could come up during that exam. And so that can also refer to things when we think about things for other genital exams and prostate exams and chest and breast exams, all things that are really important. But again, the providers providing that care need to be aware of practices we can do to make that the most comfortable experience we can for something that is not going to be comfortable for most. So I wanted to go in a little bit about contraception or birth control, again, to make sure we have a working knowledge of how this may impact trans and non-binary folks differently, and to make sure that things that may not be out there for everybody's universal knowledge, we can help start spreading to make sure that people are getting accurate, correct information. So when we think about when we think about contraception, there's two ways we can think about it. We can think of proactive contraception options, meaning things that we can do in a more planning stage, and emergency contraception, meaning that I need to do something now because I've had a sexual encounter and I need something to prevent an unwanted pregnancy. And then how can that apply in specific ways for trans and non-binary folks? When I think about emergency contraception and access to it, the same as proactive contraception, we know right now that with the Dobbs decision and other laws and bills and policies we're seeing across different states, that access not only to things like abortion, but access to contraception, emergency contraception, and other aspects of reproductive care and family planning are in jeopardy in different degrees. And we need to keep in mind that there are many reasons somebody may be seeking this care. So it could be that they need access to these medications for nothing related to contraception or to prevent pregnancy. It could be because these medications are necessary to manage symptoms that they have. It could be somebody who has a condition like PCOS, polycystic ovarian syndrome. It could be a trans or non-binary person who is trying to prevent menses because that is really dysphoric and triggering for them. Or it could be they're trying to access emergency contraception after an assault, and making sure that they have access to this medication is necessary to survival and life, to make sure that they are able to get the care that they need to help prevent further trauma and potential further medical risk, especially when we're thinking about how that might impact folks that have experienced violence. So when we think about these medications, I like to highlight this resource from reproductiveaccess.org. It is accessible to everybody, and it's written in a way that's not meant for just medical providers, which I love. This is one page of it as a screenshot, but it is one of the few gender-neutral birth control resources that exist. So there aren't many, and I love this because it doesn't ever once reference gender. It doesn't make any assumptions about somebody's identity or body. It just really explicit and exhaustively goes through different birth control options, the pros and cons of them, things like this one causes heavier bleeding. This one is something that's completely reversible. This one is something that requires a procedure so that people can make fully informed decisions without the trauma of having to read things that aren't really written for them or how they identify. In general, when we think about options, we know that when I think of somebody who has a uterus, there are options that are using hormones. So there are ones that use progestin, which is one type of sexual hormone. And then there's others that use both progestin and estrogen. What we know is that from what we know, even though there's a lack of evidence, these all seem to be very safe with testosterone, so people who are on testosterone therapy, and we don't see, at least from current evidence, major interactions, meaning we don't anticipate the positives and the progress on testosterone to be interfered with at all by these birth control options. But if people are worried, then there also are options that don't have any hormones in them whatsoever. And then when we think about somebody who has a penis, options that can help when we think about birth control and contraception can be things like condoms, and then more permanent options like an orchiectomy, which is a procedure that removes the testes. And that's something that often many people pursue, not related to preventing pregnancies, but it can be a part of that gender affirming medical intervention or transition that people can access, and vasectomies, which people can also access. So this is just a slide to show some of the different examples of those birth control options when we think of things. So you can see one slide on the left has things that have hormones in them. And there's lots of different ways people can achieve that. There's injection that people can do. That one's called Depo-Provera, if folks have heard of it. There are rings that can be used and inserted. There's patches and pills. There are more long-acting options like the IUD. There's ones with hormones and not hormones. And then there's the implant, which is the one that goes in the arm, if people can see myself demonstrating it, that goes under the skin, which some people who are looking for a long-acting option that don't want to have anything invasive done regarding their genitals, that can be a good option for some because it doesn't require them to get unclothed or anything during that office visit. And then we think of non-hormonal options. There are ones that require prescriptions or a procedure like the IUD, vasectomies. And then there are things people can access without ever going to a provider. So different types of condoms, like external and internal condoms, spermicides, diaphragms, and other things like sponges and cervical caps, which I think not as many people use these days, but they're still out there if folks are looking for them. And because we don't have a lot of time, I'm not going to go into a lot of the different risk and benefits of these different types of options. We included the percentages of how effective they are for you all to have access to later. But also important to keep in mind that when we think about all these options, when it comes to sexual STI risk, like risk of sexually transmitted infections, condoms are going to be the best option to help also prevent that, but somebody may want to use a other form of contraception or birth control, but still be using condoms to help prevent any infection. So this is an example of a resource brochure that Jay and I both helped with a couple of other coworkers and colleagues put together. And we can also share the full resource if folks are interested, but we helped create a guide about what birth control options could be right for somebody when they're trans, because one of the things that can also be really helpful when you are providing care for somebody in a office space is to make sure that you have materials and education that mirror and look like the person that you're seeing. And so making sure that they're not having to rely on pamphlets that only focus on women and use very women focused and centered language, but also feels relevant to them. So we did this in partnership with a sexual and domestic violence organization in Virginia, and it works really well, and it's a great resource and tool that we can share with folks online and in our clinic that helps them have some education materials that they can review when they're trying to decide what makes sense and is best for them. So when we think about emergency contraception, so unlike the other options, which were more that proactive side, these are options that are available within a few days after a sexual encounter that could have caused a pregnancy that is not wanted, or somebody could have been involved in an assault and is trying to have a medication available to help prevent any possible pregnancy that could have occurred during that assault. So the options that exist in our country when it comes to emergency contraception, there's options that involve taking a pill, and then there's options that are those IUDs. And IUDs, for people who are unaware, are intrauterine devices. So those are, that is a device that has to be inserted during a medical exam or procedure. So it has to be done in a provider's office. And those are those long-acting birth control options. So once it's placed, it works both as emergency contraception, but then also turns into that proactive contraception after. So that can be a good option for some people. Ella is one of the pills that's available. You can take it for up to 5 days after the encounter, and it can help prevent pregnancy. It does require a prescription, so that can sometimes be a barrier because you do have to get a prescription from a healthcare provider in order to pick it up from a pharmacy or get it from a mail order pharmacy. The other thing that's important to keep in mind with Ella compared to Plan B is that we know that Ella is more effective not only for up to 5 days, but also based on somebody's body weight. We do know that Ella is more effective for people who weigh above 165 pounds. Unfortunately, through data, Plan B has shown to be less effective for people who weigh below that body weight number, which further can cause more stress and stigma and trauma. And so I highlight that to make sure people are aware of it, because often when people are trying to access emergency contraception, that's not a conversation that happens, or if so, it can also sometimes not be done in a good patient-centered way by using negative language when referring to people's bodies and body size and shape and size. And so it's important to keep that in mind when we're talking to people about their options. Levonorgestrel, or as most people know it, Plan B, is more effective within 3 days. So Ella is good for 5 days. Plan B for 3 days. And it's available at most drugstores and pharmacies. It doesn't require a prescription. Also, some offices, like some Planned Parenthoods, for example, may also be able to provide it for you from their centers, and it may be cheaper. So that can be a good thing to consider too, if cost is a barrier. And then it also has lots of generic versions. And so I included some of those names because you may not see it as Plan B and on the shelves. And so it's good to know what other names it may be going by. Like I said, the IUDs are options. These are the IUDs that are approved for emergency contraception so far from the FDA. Those are the Paragard, Mirena, and Myleta. Paragard is the one with no hormones. That's the copper IUD. And then the Mirena and Myleta both have hormonal components. So those can also be important when we're thinking about people who might be worried about having those hormones and any potential interactions with their other hormone therapy. They're also good for up to 5 days. And like I said, they're long acting. And so once they're placed, you can keep them in place, and then they can also prevent future pregnancies as well. With all of these, like I said, we want to make sure that we're trying to provide access to these medications as soon as possible, but definitely within 72 to 120 hours or 3 to 5 days. All of these can safely be used by transgender men or non-binary folks while on testosterone. And testosterone can decrease ovulation, meaning it might limit somebody's risk for pregnancy or conception, but it does not work as a birth control method. So people can still get pregnant while on testosterone. So it's important to know that these resources exist, and emergency contraception shouldn't affect somebody's testosterone. So it shouldn't cause their testosterone levels to be impacted in negative ways. It shouldn't start changing anything regarding their emotional or physical well-being, or some of those effects like facial hair and deepening of their voice and body shape and size shouldn't be impacted at all by any of these medications. When thinking about specifically trans and non-binary patients or community folks and emergency contraception, there are important things that we want to make sure we're assessing when we're thinking if emergency contraception is indicated. So importantly, did the individual who had a uterus experience sexual violence with someone where pregnancy is a possible outcome? Are they coming in after a consensual encounter where their sexual partner can make sperm, so meaning pregnancy could have occurred? What type of sex do they have with their partners? I use the acronym PV to mean penile vaginal, or are they having receptive anal or oral sex? So what type of sex are they engaging in, that behavior piece that we talked about earlier? And has the person had any gender affirming surgical procedures, or might have had surgeries, same surgeries for non-gender affirming reasons, for other medical reasons that would not make a pregnancy possible? So that could be something like a hysterectomy or a bilateral oophorectomy. That is the fancy medical term for having your ovaries removed. And other considerations is that, like I said, testosterone does not reduce the efficacy of emergency contraception. So being on hormone therapy is not going to reduce the way that these medications work. They will work just as well. And also, they will not have a kind of quote unquote feminizing effect. So a lot of people I talk to are worried that I'm taking something with progesterone in it, or if it has estrogen, and is that going to start causing those unwanted effects that I know that that hormone can do. An IUD insertion, like we talked about before with like pap smears, can exacerbate dysphoria in some people. So using those options that exist for us as medical providers to help make that more comfortable. So that could be an anxiolytic, so something like a pill that somebody can take to help work in a more kind of locally sedating way, or we can also use medicine local to those parts of the body that can help provide some numbing to make it more comfortable. It's important to counsel and educate people when they take these medicines that they can experience bleeding and cramping, because that also could exacerbate dysphoria. So thinking about emotional stress and trauma and their mental health and well-being, and making sure that they have good resources and coping tools if that does happen, so that they have ways to get through those few days while that might be occurring. I always highlight pharmacy and insurance concerns whenever I'm talking about any prescriptions that involve trans and non-binary folks that have anything that is typically gendered in healthcare, because insurances and pharmacies both sometimes will like block a prescription and say, I don't know if this is appropriate because this person's listed as this gender and you're prescribing something that I don't think they should get. So sometimes you may need to include a note if you're writing a prescription that says like, you know, this medication is appropriate for patient's sex, just to prevent them from not getting the medication when they need it, because like we said, it's really time sensitive. So sometimes we do have to do those steps to try to make sure that we're kind of being proactive to prevent any problems on the back end. There are online options for certain emergency contraception. So like the Ella pill, not so much for an IUD, you have to do that in an office, but there are like telehealth resources. So somebody who may not be comfortable going to an actual provider office, or may not have somebody local to them that is safe to go to as a trans or non-binary person, may be able to get it online. Confirming emergency contraception was effective can be really important for somebody on testosterone therapy, because testosterone therapy often stops somebody's bleeding, their monthly bleeding, and so they can't rely on that as an indicator that it worked. So they might need to take something like a urine pregnancy test in a couple of weeks to be sure that the medication worked. And then it's important for people who are receiving these medications, or people who become pregnant on testosterone and want to continue their pregnancy, to know that testosterone can potentially have what's called teratogenic effects. Any medication that's teratogenic means that it can have a negative impact on a pregnancy. And so it's important that people are counseled on that, and they may need to stop their testosterone if they're wanting to continue a pregnancy, both for their own health and for the health of the fetus as well. So we've talked about birth control and emergency contraception, to thinking of ways to prevent pregnancy, but it's also important that we keep in mind options that people have in order to have healthy families and healthy pregnancies, and parenthood options that can exist for folks. These are not specific to trans and non-binary or LGBTQ folks. These are options for everybody, but it's important to think about how they might be inaccessible or more challenging to access for folks who are trans and non-binary. So we can use assisted reproductive treatment. So things like IVF, egg banking, sperm banking, using surrogate carriers, donations of like sperm and embryos and eggs, and home insemination is an option that I've worked with folks for, and it can be a good option for folks who may not feel like a clinic is a safe space for them to be able to conceive. Intercourse or sex through sex is one option, and then adoption and foster care, of course, can be other options that people can plan families and be able to have the parenthood that they are seeking. So when we think of the intersections of how access to this reproductive care can be problematic with our current political issues, we referenced this when we talked a couple weeks back, but the Dobbs decision, for those who may not know it by the Dobbs decision, is the Supreme Court decision that reversed Roe versus Wade and is now impacting abortion access across our country. So when we think about the implications of that legislation and the anti-trans legislations we're seeing pop up in different states, particularly regarding trans youth, it's important to consider that when we think of trans and non-binary people, often are at the intersections of poverty, they have less access to healthcare coverage, kind of from a population perspective, and thinking about these steps that can make traveling more difficult, accessing care more difficult, and especially when we start restricting where people can access care through legislation that may make it so that people cannot afford or access care, and it's not safe for them. So people may not be able to take off work to travel. They might not have the means or transportation to get to other states to access care, and thinking about how that can impact people being able to make informed decisions and have autonomy over their own health and body. We also, as we've mentioned, know that with these decisions, we're seeing negative implications, not just for the community and patients, but also seeing like longer waits in healthcare centers, burden on the healthcare workers' sides from fatigue and burnout. So it's impacting everybody when we think of the whole spectrum of what this means when we start restricting access. And it's important also, I think, to highlight that we know that, historically and currently that trans folks are more susceptible to potential violence, and especially sexual violence and assault. And we know that many in our communities have experienced that and continue to experience violence and stigma. And now that we're seeing more legislation and more public policy and conversations that are attacking trans people, we're also seeing that being mirrored in communities with an increase in hate violence, speech, negative kind of targeting and doxing of trans people. And so we anticipate as well, because we're kind of seeing this anti-trans culture exist in our society right now with some of these policy changes, that violence and potential assault rates may go up, which also means that people need access to some of these services and care too at growing rates. Hand it off to Jay for this last section.
Yeah, so what does trauma-informed healthcare look like for trans people? I think trauma-informed sometimes is used as a word. It's kind of one of those buzzwords that a lot of people have that use sometimes, but not always might always apply to all of their services. And certainly when some people think of trauma-informed services, they just think of it in the lens of being trauma-informed, like working with survivors, which is certainly a huge part of being trauma-informed, to make sure that we're doing justice to folks that have experienced violence. But oftentimes we're leaving out a lot of other trauma that people experience. So for example, when we think of ACEs, which if folks are not familiar with it, cover trauma that people experience when they're younger, and it looks at things like, has someone in your family experienced incarceration, or were you not sure about receiving food when you were a child? So much like how we need to broaden trauma when we think about trauma in our lives, we also need to broaden it when we think about trans people and people that experience a lot of what we have already talked about as far as like stigma and shame and attacks. Like historically, trans folks have experienced a ton of trauma in the medical industry. And it's something that, is super important to Afton and I, to, as medical providers, to recognize that we are in a field of a field that has done wrong to so many trans and non-binary bodies, as well as like people of color. So just to recognize that there's history attached to trans people being misused and by the medical field. And so not only in the current context when we're talking about like trauma right now that's going on in legislation across our country, but also just to be mindful of the history, that this is not just something that is currently occurring and that we need to be aware of, and that trans people have experienced this for so long. And so when people are coming through your doors or deciding not to come through your doors, whether that be a therapy office or a doctor or your hospital or something like that, that there's that trauma that we have experienced or maybe have not experienced ourselves, but that we know has happened to trans people. We don't have to necessarily go through the trauma ourselves to understand and feel what it's like for communities to be targeted and harassed, and especially in today's day and age where social media and things like that are at our fingertips, where we can just like be checking out our like TikTok or Instagram and our Facebook, trying to like catch some cute cat videos or something, or read some funny memes, and the next thing you know, you're scrolling and watching like a trans woman get attacked in a McDonald's or something like that. I don't know about you all, but that happens to me a lot. So it's mindful to keep about how trauma carries with trans people all over the place, and then also look at it through the lens in which we're currently existing in the world today, where we are seeing things like the Roe decision, and I'm sorry, the Dobbs decision overturning Roe versus Wade, and grieving over the loss of autonomy over their bodies, and then also seeing the attack after attack after attack on trans people when it comes to playing sports, using the restroom, having access to hormones if you're a youth, parents being labeled as child abusers for have supporting their kids through this. So it's coming from so many different directions, and it's really heavy for a lot of our community to be navigating the world like this. So it's just really important to keep those things in mind. And if you aren't aware of some of those things that I just mentioned, and I mentioned those things and you were like, holy crap, like child abuse for people that are supporting their trans loved ones, I encourage folks to just to be mindful of that and do your own research so that you know what people are carrying with them, as well as like the historical part of how trans and non-binary people have been treated in our country specifically. So fear and safety concerns. So as we know, accessing this care right now, this is so real. I literally just did an intake last week. I don't know what day it is because what is time? But it was last week, and I did their intake. I talked to them about hormones, answered all their questions about methods and injections and all that fun stuff. And then the person was like, walk me through what it's going to be like to come into your clinic with protesters. Like, what am I going to need to know? Like, and we kind of did almost like a mini safety planning type thing where we gave, like, I gave suggestions about what you could do, where you could park, or like all these kinds of things, talked about, you can bring a buddy, like all these kinds of things. So just know that this is on people's minds, that people are just having fears in general about accessing care at Planned Parenthood or other places that that offer reproductive health care that are also under attack, that do trans care as well. We're seeing increased concerns about seeking trans care in general, especially for parents with trans youth. I'm talking to a ton of parents right now that are like, really wondering if hormones are going to be taken from their kiddos, or whether they're going to have to move. In the state that I'm currently in, our governor is and the Department of Education have released some really yucky anti-trans language for schools. So those kinds of things, just like I mentioned, legislation, trauma, and their care are all things that people are talking about. Um, People are really concerned about their digital footprint. So this is like a newer tactic. It used to be, you know, like when abortion clinics and things like that were being attacked, it was like bombs like in the windows or people showing up at their houses. But what we're now seeing is more of that digital thing, doxing, which is a term meaning getting someone's personal information, like their pictures, their addresses, you know, that private like information, and putting it online. So a lot of our patients are experiencing that, or not experiencing it, but are afraid of it because they've seen someone else it happened. And unfortunately, now we're also seeing providers being doxed. I actually had a really close friend here in Virginia who's a therapist that her information got out from a fascist that somehow got her information from the Philly Trans Health Conference. And really yucky stuff was released online, and her Instagram was being attacked and stuff like that. So she kind of had to go silent for a little bit. And she's also a trans femme as well. So, you know, all these kinds of things. There are providers that are actually, unfortunately, that are providing trans youth care that are wondering if they should keep doing that. You know, most of these folks are like endocrinologists that have also had an interest in working with trans youth. And so there are some people that are like weighing that decision whether they should stop or not, because of all this stuff that's going on. Trans providers, so providers, like I mentioned, my friend who is a trans femme and also a provider, also providers who do trans hormone therapy, like myself, for example. I'm someone that's pretty visible in the community, and my information is out there. And so, and I also work in reproductive healthcare and abortion. So like that's something that I carry with me all the time about like my concern about my safety and my loved ones doing this care. And then looking to my community and trying to support my community and equipping each other for this stuff so we can be proactive. We're also seeing different tools being used that have never been used before. So I mentioned like the whole doxing type thing is kind of newer from the old like methods of physically doing stuff to clinics. Some of you all on this call, or if you haven't known, a couple weeks ago, a map that someone created for where someone can get informed consent care to start hormones was actually taken over by anti-trans, transphobic individuals. And the map was then used on a really disgusting, hateful website for people to see where providers are. So we're seeing these really, I hate to say this, but we're seeing some creative ways being used. So like it's up to us as community members to support and take care of one another and train each other up, and share resources to try to minimize these things together. And then, like I said, it's just impacting people's willingness. You know, there's probably some people out there that are like, what's the point? I don't want to, like, I'm too afraid to even like pick up that phone. So what can individuals do? I'm checking the time. Okay. What can individuals do? Mutual aid and beyond. So there are some things that I'd like to share with y'all when you before you leave today, of things to get your brains turning about things that you can do on an individual, agency, and structural level, and a community level as well. Because I am someone, you heard me say this in the first one, if you attended, that I am someone that absolutely believes that there are more of us than there are of them, even though at times it certainly does not see it. But I believe in the power of the people, and I believe that someday we are going to win. I don't know if I'll see that in my lifetime, but I do this work because I believe I am an ancestor to other trans and non-binary and queer folks that will come after me. So that I always, like I said, I'm a nerd when it comes to community defense, mutual aid, community organizing. I always want to share tactics about what people can do to kind of, sometimes like you just need to know that you have something that you can do when things feel hopeless and out of control and you feel powerless, because that is the tactic that people want you to feel, and you are absolutely not powerless and you do have power. So individual, next slide, please. What we can do on an individual level is we can connect with other trans and non-binary communities or members. If you are someone in the community, like you are someone that's trans or non-binary, absolutely connect. Other trans and non-binary people have saved me, and I promise you will save and help you as well too. Um, get familiar with some healthcare advocacy tools. So we have a list of some things that you can check out to use as far as like knowing advocacy tools or knowing things that people have shared about how to advocate for yourself. Connecting with abortion funds. So abortion funds historically have just been such rad organizations that have such a huge amount of information, not only to where to direct someone if they need an abortion, but also just connecting with that like community care level as well. So I absolutely encourage people to connect with abortion funds, either if you're someone that needs help, or if you're someone that's like, I want to work with people like that. If you don't have an abortion fund that's local, check out that website that Michael just dropped in the chat, because I'm sure folks would want to talk to you about starting one. I've seen a brand new one in our state happen recently, and they are just doing really incredible things for being a new organization when people got together and said, yep, it didn't exist in this part of my state, so we're starting one. Connect with trans advocacy and mutual aid groups. Once again, if there aren't any, you can start one, but there may be some wherever you are. And these groups are good to just like, a lot of them, like for example, Equality Virginia is in our state. And they have so many like know your rights, what's going on a state level, local legislation level, that you can reach out to them, all kinds of things. So research those, get connected with those mutual aid groups, people that just take care of one another, help each other with meals, clothes, rides, all kinds of stuff, helping paying for medications, like all kinds of stuff. Just, try to search that in your area. Practice joy and pleasure as much as you can. I can't stress this enough, y'all. Just wherever you can get, even if it's like one tiny piece in your day, just to try to find something that brings you pleasure and joy, whether it's petting your dog, having that chocolate you really like, spending like 15 minutes, my dog just jumped on me as I said that. Having that 15 minutes with your coffee uninterrupted, having an orgasm, taking a bath, like any kinds of things that you can practice your desires and autonomy, I highly encourage. If you are experiencing any sort of weird, unsafe, like things that feel wrong when you're inside or outside a clinic, especially if you're at Planned Parenthood or like a reproductive type thing, bring it up to a staff member. I can assure you that those organizations have such a strong security culture that that kind of information needs to be passed up to the people that what do I want to to say, keep track of it. So definitely report it, say something about it. Buddy up, like I mentioned, see if your friends can go with you, and research digital defense options. In the links, like I mentioned, there are a ton of different organizations, especially right now, that are doing information about like how to kind of clean up your social media, or like be aware of where your name is online. Forge is also doing something, I believe, which Michael will bring up very soon about this, which I'm so excited to join. That's definitely something that you can start looking into. And then I'm going to real quickly go through the next couple so we have time for questions. Agency, if you work at an agency, definitely what I would recommend the most is forming health alliances and building relationships among multidisciplines. There are many examples of places here in Virginia where we didn't see something and then we started alliances where we're able to share things together. And what we do is we share resources, we skill each other up, we have trainings, all kinds of things. We don't have questions to certain things, or we want to do a warm handoff to a provider that is better skilled in one thing. Like if you're a therapist and your your client is bringing up something really specific that is out of your scope, being able to say like, oh, hey, I work with this person named Afton. You should call this place and get this kind of thing. So really doing that, and just much like I just said before, just being familiar with all those organizations that I mentioned, like abortion funds and stuff like that. I think as an agency, we are absolutely, we should be responsible for knowing what's in our community. One of the other things that I thought was really rad when I used to do sexual assault and domestic violence work, I saw a lot of shelters that kept emergency contraceptions and things like that on in the shelter and the staff, so that if there was a survivor that needed it, they could just give it to them, and it was like part of their like intake process, or part of like, you know, if you go because you have like a migraine, you can also go if you need emergency contraception. And then also just really examine your organization's security culture, consult with security experts. For some people, this can be like things like the digital defense not defund, holy crap, fund that are national, like that do this work. For other people, it might be connecting with local law enforcement. I do recognize when I say that police are not always the best people with trans folks. However, I do also know that there are organizations that have worked with law enforcement purposely, trans organizations, to serve their community too. So just kind of thinking about all of those things about how your organization has security culture, like what the doors look like. Do you have a doorbell? Do you have cameras? Are you allowing your staff to leave the center alone? All those kinds of things, where the lights are, all kinds of stuff. You guys can tell I really love talking about this kind of stuff. And then lastly, we have a community level. Next slide, please. Once again, really invest in community aid, share sources, start organizations if you don't have any, develop resources, zines, handouts. Like Afton and I said, we didn't have a resource for birth control options, so we created one with other partners. You can host skill sharing events, dinners, potlucks. One of my favorite things to do is share a meal with people, because that's joy and pleasure, laugh, have a good time, be in community. But you might also say, okay, we're going to have chili tonight, and we're also going to talk about what your security footprint looks like online. Or we're going to talk about what I know about birth control for trans people, or we're going to talk about sex toys, or whatever. So yeah, just really invest in all those kinds of things. and all the resources for you. I think Michael said that Michael can share a screenshot for you, so you all can, yeah, thank you, Michael. So we can give you these. These are certainly not all of them, but they're some great starting places. Once again, if there's something that you really want that we have not covered that you're curious about, certainly Michael can get you in touch with us, and we are more than happy to do that.
Yeah.
I'm going to stop talking because
Yeah,
oh,
I'm sorry. Before we get to the question slide, I realized too that we didn't highlight or lift up this community kind of individual agency strategy,
yeah.
but we've talked a lot about all the negative legislative things and policies that are
Oh,
coming
yeah.
through that are impacting our trans and non-binary folks, in fact, it's impacting anybody with a uterus, and especially impacting, folks who experience other disparities. And we didn't talk about the other option that people can use, especially thinking about some of those resources with mutual aid and community organizing, is helping people with legal actions and steps. So that could be legal actions related to steps related to things like incarceration and like helping people kind of re-entry, but it also can be steps helping trans and non-binary folks through legal steps to update and change their gender markers and names, because we know that also another example of violence and that can happen is when people have IDs that don't match their presentation and can make them more vulnerable to violence, more vulnerable to get fired for being trans, to not be able to access certain resources. It can impact them when it comes to shelter access. And so one website on here is transequality.org or NCTE. They have a good document ID website. They're the only one that I know that has like a national one that you can go state by state on. So that's why we chose to highlight that one. But also your local state orgs probably have access to them too. But we've been a part of some initiatives to help provide free like legal counsel and to provide some cost resource sharing to help people pay for those kinds of steps. And that can be something too that you can look into that can really help people when it comes to accessing the necessary steps they need for healthy lives too. So sorry to interrupt there.
No, I'm so glad you said that, Afton, because a lot of people have this misconception that that like only specialized people can do it. When really like I taught myself how to do it. And I like to just give information to other people because some of the stuff, depending on your state, requires like signatures. And then others do not, where you can just literally be like, yeah, just go here and do this thing. So like, as much as we can like empower each other about like steps that you can do, I think that that's what makes us more powerful. So yeah, thanks for bringing that up, Afton. Yeah, so we have like 10 minutes for questions. I put my favorite quote in here because I'm a nerd, but also because it's tattooed on my body to remind me in times like today, because I know a lot of what we covered is super hard and heavy. But I just wanted to remind ourselves just to like keep on holding on, loving each other, showing up for one another, fighting for each other, and that all of that is like so important. So yeah, any questions that folks have?
So I am seeing one that's in the Q&A. Would you like me to read it out for y'all? Okay. It says, what would you recommend are some tactics to help identify and navigate trauma-informed healthcare in rural areas? Some folks who are providers may say that they are trauma-informed, but their behavior and treatment of folks is not reflective of that. Great question.
Afton, I don't know what you suggest. My brain automatically went to like a selfish thing. which is Afton and I are doing some actual like rural work right now with specifically funded under this other organization that's doing rural healthcare for LGBTQ folks. So my selfish brain went to, I would love to get in touch with folks that are in rural spaces because um, the uh, aim of that is to actually like have conversations and talk to people in rural spaces and train them up and provide like ongoing assistance and care with a rural lens because we know well, I know from growing up in a rural spot, as well as Afton, that those conversations can often look different when we're talking about identities than going into like a larger city. I think for me, a lot of times, it's a lot of. I hate saying this, but it's a lot of like sort of like hand holding as far as like really being intentional about making sure that people feel comfortable and working through some of those conversations with folks and creating that space where folks are allowed to do that in a space that feels like safe for them. That is my selfish plug. I don't know, Afton, if you have suggestions.
And for context for that grant, it's a grant that's funded through HRSA. And so I mentioned that because that's federal. And so for anybody in the US, there are a lot of grant opportunities to expand access when it comes to rural spaces and underserved areas in our country, especially tied to health and mental health. SAMHSA also has some good resources and links out there for that too. So if you are a part of a larger organization, especially if you have any connections or colleagues who are connected to any health agencies or mental health agencies that receive federal dollars, those HRSA grants are a good way to develop that sort of community and agency level intervention. That could be like a public hospital. So thinking of Virginia, that could be things like VCU or UVA or those kinds of places. Where we both lived in West Virginia, so like WVU is one to think of, and like community federally qualified health centers like FQHCs are really good places to look to. I would agree with everything you said. I think the other thing to keep in mind, some of them are in the resources we shared, is that there's a lot of sort of archived on demand online learning, and a lot of them also offer some continuing education credits, which can be a good pull for those people who aren't like really enthusiastically wanting to jump into this, but they need some credits for their licenses. And it can be a good way to start those conversations. And I think it's also one thing that's been really helpful in some of the work I've done over the years in Virginia is finding those like 3 or 4 colleagues, whether they work in the same organization or not, who are passionate about this. And we started to find a mutual meeting space and get together and started talking and figured out, hey, I've got this other person who really, I think, wants to do this well, but doesn't. And so they start inviting and we start, meeting in the evenings after work and share some food and start talking strategies and providing some of that sort of more peer kind of feedback and training. But those are, I think, some of the best places to kind of start with and looking at strategies that have worked in other rural spaces. That's also helpful. There's a lot of good data that just was presented regarding like trans health in rural spaces that can be used for some funding opportunities that was presented nationally recently and published. So if folks are looking for that kind of stuff, because I think if you can find some funding opportunities, you might be able to start building something that doesn't lead to you having to take ownership of everything, which can get exhausting too, which I think can be easier to happen in rural spaces because it's often just 1 or 2 of us that might be providing that kind of care.
That was a great question and a great answer. And I'm aware that many of us are very tired and exhausted because of the work that we do, and I want to be really respectful of our time tonight. If folks do have additional questions, Jay and Afton, I know you've offered before that we can send you additional questions. So if that offer is still open, now I've kind of forced your hand to it, sorry, but feel free to send them to me or to Caleb, and we will get those questions passed along and get answers back to you. Do you, Jay or Afton, have anything that you'd like to end with before I wrap us up and close us out? Y'all have said a lot. You don't need to say more. So it's fantastic.
Just thank you.
Yeah, thank you. I said I love talking about these things. I hate having to talk about them because of the reasons that led to all of us having these conversations. But please, like we said, don't feel like you can't reach out. We're always happy to help and share and also learn, and maybe we can start working together in some of the strategies we talked about.
So thank you both for really sharing so much stuff in this time when it's already really, really tough for you all in your individual work lives, and it's a tough time for all of us right now. So thank you for being here for session number 2, and I think we're going to record something else on the fly, and we'll talk about that some more. And thanks to our ASL interpreters who are fantastic, and for all of you who attended tonight. We really, really appreciate you being here. Have a good night, everybody. Thank you again for spending your evening with us, and we will hope to see you all next week. Thanks, everybody.
Thank you all.